Acute lymphoblastic leukemia, ALL, is a type of blood cancer that starts in the bone marrow, the soft tissue inside bones where new blood cells are made. It affects white blood cells called lymphocytes, which are a part of the immune system and help fight infection. Symptoms of ALL: fatigue or feeling tired, weakness, fever or chills, frequent infections, easy bruising or bleeding, petechiae, which are tiny red or purple spots on the skin caused by bleeding, shortness of breath, weight loss or loss of appetite, bone or joint pain, swollen lymph nodes, night sweats. Causes of ALL: the exact cause of ALL is unknown, but it is thought to be a combination of genetic and environmental factors. Some risk factors for ALL include mutations in genes involved in cell growth and differentiation, exposure to certain chemicals or radiation, Down syndrome, other genetic disorders, previous exposure to radiation or chemotherapy, family history of ALL. Treatments for ALL: the main treatment for ALL is chemotherapy, which uses drugs to kill cancer cells. Other treatments may include targeted therapy, drugs that specifically target certain proteins on leukemia cells, radiation therapy, high-energy beams to target cancer cells, stem cell transplant, replacing damaged bone marrow with healthy stem cells. Associated illnesses and conditions: central nervous system, CNS, involvement. Symptoms: headache, vomiting, seizures. Treatment: chemotherapy administered directly to the CNS. Testicular involvement. Symptoms: pain or swelling of the testicles. Treatment: radiation therapy to the testicles. Hyperleukocytosis. Condition: very high white blood cell count. Treatment: emergency chemotherapy to reduce white blood cell count. Infection: weakened immune system due to leukemia and treatment. Treatment: antibiotics and other medications to prevent or treat infection. Long-term effects: cardiotoxicity, damage to the heart muscle from certain chemotherapy drugs. Neurocognitive impairment, cognitive difficulties resulting from CNS involvement. Secondary cancers, increased risk of developing other cancers later in life. Prognosis varies depending on patient age, disease stage, and response to treatment. Overall survival rates have improved significantly over the past few decades. The specific treatment plan will depend on the patient's age, overall health, and the specific type of ALL they have. It is important to note that this information is not a substitute for professional medical advice. If you are concerned that you or someone you know may have ALL, please see a doctor for diagnosis and treatment.